Democratic Republic of the Congo is a country located in Central Africa. Much of the conflict in the Congo over the years has been fueled by the desire to gain control over its vast resources. The Congo is, per square mile, the most resource-rich country in the world. It contains two-thirds of the world's remaining rainforests and vast mineral wealth. In spite of the Congo's vast resources, it is one of the poorest countries in the world. Since the outbreak of fighting over these resources, over 5 million people have died, many from nonviolent causes such as malaria, diarrhea, pneumonia, and malnutrition. Although children account for 19% of the population, they make up 47% of all deaths in the country. About 45,000 people continue to die each month. Health problems have been a long-standing issue limiting development in the Democratic Republic of the Congo. Medical facilities are severely limited and materials are in short supply. According to a 2008 United Nations report, the Congo has a population of over 57.5 million people. Of this, 75% live below the poverty line. More than half have no access to drinking water or to basic health care. 3 out of every 10 children are poorly nourished, and up to 20% of children won't live past the age of 5. Although the Congo faces many problems as a developing country, its most prominent issue is the need for clean water. An estimated 51 million in the Congo have no access to safe drinking water, despite the fact that the country holds more than half of Africa's water reserves. During what is widely considered to be Africa's First World War, the Congo's already limited water supply became increasingly scarce. Lack of clean water has been the cause of the most Congolese deaths and illnesses, which include malaria, diarrhea, and malnutrition. Additionally, mining takes hundreds of thousands of gallons of water from the Congo's rivers, leaving behind a minute amount for the people who use it to live off of. The mining process then usually uses the pit as a waste area, which can create toxic environments and also lead to diseases. Nothing has been done about this issue because the Congo's government is not strong enough and they cannot regulate this mining process. In other areas, like along the Congo River, water flows abundantly. However, the problem lies with the quality of the water, not the quantity. The state's water utility does not have the funds that it takes to improve their water pumping systems, so they continue to use old and decaying pipes that are hazards to the health of anyone who drinks this water. Although there is imported water available, most Congolese people cannot afford this luxury because of its steep price. Most of them only make about $2 a day, while the imported water usually costs $1, a price that is not worth it for them. Our plan is to use the Congo River and the surrounding lakes to increase the amount of water available to the people of the Congo. We want to treat the water that is available to this country to be used for drinking, hygiene, and irrigation purposes. We plan on doing this by building and maintaining water treatment plants along the Congo River and all of the lakes. We also want to design and implement a pipeline and irrigation system to get water to all parts of the Congo. For the rural towns, we will have multiple pumps to give all town residents access to water. There will be 12 water treatment facilities along the Congo River and the nearby lakes. To build and design one water treatment plant, which produces 100,000 cubic meters of flow per day, costs $15 million. So for all 12 new facilities, the total amount for construction would be $180 million. The cost to maintain a facility per month is $480,000. This cost covers water resource fee, electricity fee, chemical fee, staff cost, administration cost, and maintenance and repair costs. So for all 12 facilities for 1 year would be about $69.6 million. The plan would be to at least maintain these plants for 20 years before having to update facilities significantly. So for building and maintaining these facilities, it would cost about $1.6 billion. We would then build off of the system UNICEF has begun to implement. They have been rehabilitating water reservoirs and sinking boreholes to improve access. They have also developed a gravity-based system that pumps out safe water and irrigates fields at the same time. The next $8.25 billion would go towards getting the water from the treatment facilities to the people and crops. We would do this by using new pipeline and the reservoirs and sinkholes UNICEF has been developing. This would ensure that people all over the Congo would get clean water for drinking, bathing, and irrigation. In rural towns, we would make sure there is multiple pumps and free access. The last $750 million will be used to add hygiene education to the school curriculum and to update the sanitary facilities in schools. Most of the Congo's most pressing issues such as gender inequality, lack of education, poverty, hunger, and poor health are all just symptoms of the deeper issue that is the lack of clean water. Since our project aims to increase the access to clean water, it will help the Congo in many different ways. One way in which our project will help is by promoting gender equality and improving education. Clean water can foster the empowerment of rural women. Because we would be sparing women and girls the burden of walking miles at a time to gather water, girls would be able to use their time instead to get an education or a job. Our project will also help reduce poverty rates and generate economic benefits. Poverty is a cycle that traps families for generations. Reasons why poverty is so closely tied with the issue of water is because without water, you cannot grow food, build housing, stay healthy, stay in school, or keep working. By providing water, especially clean water, slowly different components of the cycle will improve and lead to a domino effect of beneficial changes, pulling families out of poverty. With more water comes less crop loss, which in turn reduces hunger. Crop production not only has economic benefits but also has a huge impact in the nutrition and amount of food available to a community. Water that isn't used for drinking can also be used to create more fertile fields. Safe drinking water and basic sanitation is of crucial importance to the preservation of human health, especially among children. Safe water and education on proper sanitation practices, such as hand washing and brushing your teeth, will help to reduce many of the deaths and illnesses plaguing the Democratic Republic of the Congo.